See, that's the things that are coming out of your mouth, child. Babbling, insanity, delusions.
Man, you are one pathetic loser.
Dr. Steve, I hope you're better at prostate screenings than you are at radio screenings, you son of a bitch.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by two really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent of Citizen Kane. And if I don't get it now in a tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease. So I'm paging Dr. Steve. Dr. Steve.
It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio. Now a podcast. I'm Dr. Steve with my little pal, Dr. Scott. Wow. The traditional Chinese medicine provider. It gives me street cred with the... shit, I don't want to start this over again. Is your mic on? Your mic's not even on. Try it again. There you go. And then I turn my mic on. This is very professional. I've been doing this for 20 plus years. 19 total. And still can't get the... And Carl would say, oh, you can just redo it. And you know what? Fuck off, Carl. I'm not doing it. I'm not part of your system, man. All right. Anyway, I don't know where I was. If you have a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call. 347-766-4323. That's 347. Pooh hit. We're on it. Follow us on Twitter at Weird Medicine and drscottwm. Visit our website at drsteve.com for podcast, medical news, and stuff you can buy. Most importantly, we're not your medical providers. Take everything here with a grain of salt. Don't act on anything you hear on this show without talking it over with your healthcare provider. Maybe we should do this more often.
There you go.
Maybe that's what the problem is. We just get rusty.
Sounds good.
Check out roadie.drsteve.com, the Roadie robotic tuner. They have a new one. Have you played with yours?
I have. It works really well for my guitar.
Yeah.
The mandolin, for some reason, it doesn't like tuning in the high E.
Really?
And I haven't figured it out. I mean, I'm sure it's user error. I'm sure it's user error.
You can use the app to program it for different instruments. Mm-hmm. And you might be able to mess with the sensitivity on that. We should look at it.
Yeah, I would guarantee it's user. It's something I'm doing wrong. Sure.
Well, we need to get it fixed. Email the company and see what they say.
I could, yeah.
Yeah, they're great.
Yeah, but
they're
it's
very
wonderful.
Responsive.
Yeah, I put brand new strings on my guitar just last weekend, and just like it was easy.
Yeah, it winds too. It does the winding.
Yeah,
it's awesome.
Yeah, it was pretty cool.
So check it out. It's a robot. It'll tune your stringed instrument at roadie.drsteve.com. It's ROADIE. Check out Dr. Scott's website at simplyherbals.net. How's that going?
Going all right for now.
Yeah, you still doing it?
Doing it for now, yes.
Okay.
We've still got some stuff. So
well, there's things still
we're
pending.
negotiating.
Best CBD nasal spray on the market as far as I'm concerned.
Yep.
And then, check out patreon.com/weirdmedicine. The new studio is finally up and running. I've still got some things to do in it, but I can use it. I produced my first video for Angela Does Horror. Angela was one of the producer and co-host of Normal World that no longer exists. And but she always had this website and YouTube channel where she reviews horror movies. And so the new thing that we're doing is she had me review the Human Centipede. and so, from a medical standpoint.
Okay.
And my position was the human centipede would literally last 5 minutes once you got everybody hooked up. At least 5 minutes after the first donation from the lead person.
Okay.
Because when do you know what the human centipede is?
Nope. I have no clue. No.
Okay.
It's this Dabbleverse thing. It's this Dabbleverse thing.
No, it's not. It's a movie. No, it's a horror movie. And this guy, I haven't seen it. I have no desire to see it. But he or she, I don't know who does it, sews the mouth of one person to the anus of another person. And then they go in a big line.
Oh.
So it's the human centipede.
I don't know how I missed it.
Yeah, I know. So my position was this would literally last 5 minutes from the first quote-unquote donation from the first person, because as soon as they, transmit bowel contents into the mouth of the second person, what are they going to do? They're going to vomit.
Yep.
And where is it going to go? It can't. It can't go back into the into the donor, because that's kind of a one-way valve for the most part.
Yep.
So it's going to go out their nose and then into their lungs.
Yep.
So now they're going to aspirate and then they're going to die.
Yep.
And what happens when you die? You relax your bowels. So now the third person, it's going to happen to them. And then they're going to die, and then the fourth person, and so on and so on. It's a domino effect, and they're all going to croak. So if you want to see this video, just go to youtube.com/@weirdmedicine or youtube.com/@Dr. because I'm going to put all those kinds of videos just over there so they're not mixed up. I'll have one channel where there is not a bunch of different types of content, because on our YouTube channel right now, we've got our podcast and I've got my YouTube shorts and all this stupid stuff. And, we don't really do a video show. I mean, the people show up like the king of the Dabbleverse and Luke of the Blind. And, Ari Jane is there. Hello, Ari Jane. We've never met, but I have heard her name multiple times. And then, okay, are you deleting things that people are saying?
I deleted one thing.
Okay.
One dummy.
Okay, that's fine. And is that you, Scott, QQ3UI?
Yeah, I don't know why that is.
Okay, all right.
Believe me, you know me well enough. I don't know how to turn anything on.
Yeah, no.
Yeah.
Yeah.
I just show up.
Yeah, Luke of the Blind says Human Centipede is the grossest horror movie ever conceived. Anyway, where was I going with this? Yes, we just do a behind-the-scenes video live stream of us recording our audio podcast. That's where all of our income comes from. That's where all the views come from. And, we never really pushed the video side. But I'm going to start doing more videos, and we'll see.
Cool.
I'm going to give it a year to grow. If it doesn't, I'm just going to sell the whole kit and caboodle. So.
Sounds good.
Because I'm 100 years old and I say kit and caboodle. And that 23 skidoo. And Tyler, too. I think that's how it goes. All right. Check us out on patreon.com/weirdmedicine. And if you want me to say fluid to your mama, cameo.com/weirdmedicine. All right. You ready?
Oh, yeah.
You got any topics today? Of course not.
Nope.
Number one thing, don't take advice from some asshole on the radio.
All right. And you were asking me about Stacy.
Yeah.
And, here he is.
Oh, cool.
Hey, it's your friend with the dumbass questions from time to time.
Awesome.
Just kind of curious, is it possible for a mother's breast milk to change colors according to what she eats?
Yeah, of course.
Just stupid questions that pop in my head.
It's not stupid.
Bye, family.
It's actually a good question, because the everything that we secrete comes from our bloodstream, and mucus is hyperfiltrated blood mixed with some proteins that are produced by cells in the mucous membranes. And, breast milk is derived from ultrafiltrated blood as well, but then there are specialized cells that add fat and protein and antibodies and stuff like that to it. So breast milk can be white or yellow, and every once in a while it could be blue, green, pink, or orange. And, it can be normal factors like leafy greens or carrots. So you'll get yellow-orange from beta-carotene in sweet potatoes, carrot, squash, and then colostrum, which is the early breast milk, is also yellow. And if you eat just a ton of spinach or kale or green food dyes, certain green food dyes can turn the breast milk slightly green. And, blue, again, from food dyes, or a lower fat, mature milk that sat in the breast for a long time, it can turn kind of blue. Now, red can come from beets, but it could also be from blood from cracked nipples. And, black or brown can be from certain drugs like minocycline or old blood. Now, if you see pink or red and you haven't been eating something that might turn it pink or red, then you probably ought to see your OBGYN or your primary care provider. If it's black or dark brown, same. If there's any sort of weird digestive issues like gas or unusual stools, what the mother eats can affect the kid. So, I knew some people that the kid was colicky until the mother cut out certain foods from her diet, and then all of a sudden the kid turned around. So, all right. Questions, comments?
Great question, Stacey.
Very good. Yes, he's a pretty good feller.
Pretty good.
All right. Let's do this one. Oh, this is a good question. I like this one.
Dr. Steve?
Yes.
Hello.
Hello.
Thank you for answering my calls that I have asked before, questions rather than I have asked.
Oops. Uh-oh.
Hey, it's your friend.
No, I didn't mean to do that. Sorry. I was trying to delete that. Let's try that again.
Dr. Steve? Hello.
Yes. Hello.
Thank you for answering my calls that I have asked before, questions rather than I have asked before.
Yeah, man.
I appreciate it.
Of course.
I have a question that I believe I asked you, but I don't know if you answered.
Okay.
I was recently in ICU on a ventilator.
Oh, gosh.
And I was on there for 13 days.
Oh,
nice.
And they were very adamant that they had to take me off the ventilator that day because at 14 days,
or else
they would have to put in a trach.
Right.
Like, I'm guessing that's one of those voice box things. Do you understand? Well, of course you understand, but why would they have to do that at 14 days?
Yes.
Isn't there stories of people who lived in ICU on a ventilator for years and came out and...
Yeah, but they had a tracheostomy, though.
And didn't have a voice box, or I guess.
Yeah, it's not a voice box. So let's clear that up. Whenever you say ostomy, that means you're putting a hole in something. Okay.
Yep.
So a tympanostomy would be a hole put in the eardrum.
I've had two of those.
Have you?
Okay.
Yeah,
terrible.
To allow equilibrium of the. It's not to drain it. It's to allow pressure to equalize.
Yep.
So a tracheostomy would be a hole placed in the trachea. And we do that for this reason. When you are first put on the ventilator, they shove this tube down into your trachea. And then, but if they put air in there and they just had a tube, the air would hit the resistance of the lung, because the lung is not inflated.
Right.
And you're trying to inflate it. Well, there's resistance to that, of course. So the air would just hit that resistance and then come right back out around the outside of the tube. So to prevent that, they there's a balloon at the end of that tracheostomy. I mean, it's the endotracheal tube. And the balloon inflates, allowing a perfect seal. So when you shove air down there with pressure, it opens. It goes into the lungs. It pushes air into the lungs, and they inflate rather than that air escaping around
like
there.
Blowing up a balloon.
Right.
Yeah.
Right. Yeah, if you tried to blow up a balloon and you don't make a perfect...
If you don't close your mouth away.
If you don't close your mouth around it, the balloon's not going to blow up. Right. You're just going to blow air around it. That's a good analogy, Dr. Scott. I'll give you a bell.
Give thyself a bell.
Because you actually helped me. So the problem with it is the trachea is lined with a mucous membrane, and it has very small blood vessels, capillaries running through it. And when you inflate that balloon, the pressure pushes the blood supply away from that area. Of course it does.
Kind of mashes it, yeah.
Yeah, you push on your hand even, you can blanch it, that because you're pushing blood away from that place that you're touching. Then when you let go, you can see the blood rush back in. Well, 14 days about all the trachea can take of that, because after 14 days, you can kill the mucous membrane. You kill the mucous membrane, you end up with a hole in your trachea. Right. Now, that 14 days is not an absolute. I have seen people, yes, go much longer than that refused a trachea, but they couldn't take them off the ventilator.
Okay.
And I've seen people go 21 days. I saw somebody go up to 28 days, and they did okay. But you can't count on that. You don't know if there's no blood test. You can say, well, this person could have a endotracheal tube for 2 weeks. This one could only handle it for 10 days, but this one could go 3 months. There's just no way to know.
Okay.
So to prevent that, they found that 14 days will mostly prevent that tracheal damage.
Gotcha.
And the tracheostomy is just a hole and in the trachea, and they put a tube in there, and then you breathe through that. Okay. And that can stay in forever. Mm-hmm. And I've had some people, they just take the device out, and they've just got a hole there, and that's what they breathe. I've seen people smoke through that.
Yes.
That's how degenerate smoking can be. And but it is because there's no resistance to flow, you can't talk very well through that, because when you start, the way that you talk is the vocal cords close and you breathe against that resistance, and that resistance causes them to vibrate. Mm-hmm. And that noise is then modified by the upper airway into intelligible speech with your tongue, the size of your, the oral cavity. You can change the quality of the sound, all that stuff that we do naturally when we talk. The vocal cords really just make different buzzing sounds. Mm-hmm. And that are then modified. So when you have that tracheostomy in there, there's no resistance to flow anymore, so the voice box doesn't work right. Mm-hmm. So a lot of those people, even if they haven't had their voice box, the vocal cords removed, have difficulty speaking, so they have to get a speaking valve that allows them to close that thing so that now they can push the air through the vocal cords rather than out the hole in their neck. So that's what that's about. Excellent question. It comes up in the hospital all the time.
Oh, yeah, absolutely. Yep.
So what you're trying to do is prevent a catastrophic failure of the vocal cord. Mm-hmm. I'm sorry, of the trachea.
Because, if that thing goes without blood flow, you can cause a whole.
You just got a hole in it, and we want to put a hole in there under controlled circumstances, not just because of a catastrophic failure. All right.
Hi, I'm Jim. I'm not an actor, just a guy living with prostate cancer. My wife and I face each day head on. We asked my doctor about Xtandi enzalutamide.
Xtandi 40 milligram tablets treats men with prostate cancer that has spread to other parts of the body and responds to a medical or surgical treatment to lower testosterone. Xtandi may cause serious side effects: seizure, a brain condition called PRESS, allergic reactions, heart disease that can lead to death, falls and bone fractures, swallowing problems, or choking that can lead to death. Stop Xtandi and get medical help at once if your face, tongue, lip, or throat start swelling. Tell your doctor at once if you faint, have a seizure, quickly worsening headache, decreased alertness, confusion, vision problems, chest pain or discomfort, or shortness of breath. Xtandi can cause harm to an unborn baby or miscarriage. Use birth control during and 3 months after Xtandi. Common side effects include muscle and joint pain, feeling unusually tired, hot flashes, constipation, less appetite, diarrhea, high blood pressure, bleeding, falls, fractures, and headache.
Visit Xtandi.com to watch my story.
Okie dokie. All right, that's a good one. Here's one for you, Dr. Scott.
Uh-oh.
And I have some
Hey,
suggestions
Dr. Steve.
too. Hey.
I'm a 39-year-old male.
Yeah.
A few years ago, around age 35, I discovered that I have hypermobile spectrum disorder, which, of course, I've had my whole life but didn't realize. For 13 years, I've been an avid weightlifter, and nowadays it's not working out so well. Because I have hypermobility, I always have about 5 different injuries at once. Right now, I have plantar fasciitis, bicep tendonitis, golfer's elbow, radial nerve impingement, and some pain in my right hip as well. And I was wondering, I don't want to give up weightlifting. I don't know if I could.
Yeah.
But I was wondering if you had any advice on what I should do in my life to change this so I'm not always just riddled with pain every day. And I would also like to know if you have any advice on how I should go about the healthcare industry, because every time I go to a doctor, they're always hyper-focused on one injury at a time. So like a shoulder doctor would be hyper-focused on the bicep tendonitis.
Correct.
Whereas no one really knows how to treat hypermobility spectrum disorder in general, so that I can be relatively pain-free.
Right, you got to look at the
on a
whole
normal,
patient. I agree.
everyday basis.
This is part of the
If
problem.
you have any advice, man, I'd really appreciate it, and I'm glad the show's still going because I'm a new listener from the Dabbleverse.
Hey, okay, thanks, man.
Keeping it going. The show's great. Bye.
Hey, thanks. So let me just define hypermobility spectrum disorder for a second. It's a connective tissue disorder. It used to be called hypermobility type 3 or hypermobility Ehlers-Danlos syndrome. And it's a genetic disorder. And these people are extremely double jointed and have elastic tissue and stuff like that. So let me just throw out a story. There's a movie. Have you ever seen My Dinner with Andre? It's 2 hours of Wallace Shawn and this guy Andre, who was a director, eating dinner for 2 hours.
Okay.
And they just talk.
Okay.
But at one point, Andre talks about when his mom was dying in the hospital. And she's dying. She'd fallen and broken her wrist, but she was in the hospital, dying.
Okay.
I can't remember if it was cancer or whatever it was. But she was soon, to be leaving this world. And he talked about how the orthopedist who had fixed her wrist went in and looked at her and came out and said to Andre, she's doing great.
Right.
She's doing great.
Right.
And he was like, all he looked at was her wrist. He didn't look at this woman who's laying in a bed literally dying. And so that's what this guy's talking about.
Agreed.
So, and he's got a bunch of stuff going on. He wants a generalized approach to this, a quote unquote holistic approach. I'm not talking about necessarily holistic medicine, although
of course
Dr. Scott practices a form of that. But, you need to look at the whole person. So anyway, Scott, talk a little bit about, from the sports aspect. He wants to continue to lift. I know there are machines that will kind of constrain the joints so that you can do different exercises and stuff. I have a suggestion for him, but go. You take it first, and then we'll talk.
Yeah, I was kind of going along the same line as you. The first thing is with hypermobile issues, joints. What we like to do is remind folks that when you have pain, tendonitis in these joints, it's from repetitive motion.
Yeah,
and a lot of times it's from overuse and over rotational stuff.
Right.
What I would say is identify a specific muscle you want to work out, and then focus on that muscle by not taking it through a too far of a range. So to be specific, like bicep curls. If you want to do bicep curls, you don't need to do standing bicep curls where you're letting your arms fly through space.
Correct.
And you're letting you're rotating your wrist and tweaking your elbows and giving yourself tendonitis, like you said he had in his elbow. I would sit and I would put my elbow on the inside of my knee, and I would drop that weight in a really slow, controlled fashion straight down, and just isolate the bicep, and only go to the end range and not past. In other words, don't let any motion, if you're doing bench presses, if you're doing any kind of exercises, squats, don't go past what would be considered a normal end range, number one. Number two, cut down on the doing 3 sets of
the ballistic
10 kind of stuff.
Well,
First of all,
yeah.
So in other words, doing multiple rounds. I love what I call the 30-second bicep curl or the 30-second bench press. Take a really lightweight and count 10 seconds down to your. We're doing a bench press, okay, we're laying on the bench. 10 seconds down to your chest. Hold it for 10 seconds. And then back up for 10 seconds. So that's a 30-second bench press.
Okay. It's like square breathing, except.
Exactly. Very similar. Instead of taking a 400-pound and going, bouncing it off your chest and pushing it back up.
The ballistic stuff is not good for him.
Because what he really wants to do is continue to have strength. He wants to continue to have, range of motion and less pain. And you can do these things, but you want to stabilize. You want to strengthen some of the smaller stabilizing muscles that will help in this whole thing. Okay. So do that. The other thing I would encourage is Pilates.
That was one of them.
Oh, was it? Okay. I'm sorry.
No. Go ahead. Yeah.
But I think Pilates is a great way to continue to work out, exercise, maintain strength, and in a really controlled fashion.
Yeah.
Yeah. So that's the thing. Don't do stuff that's going to let your free kind of flowing, twisting motions, heavy loads,
right?
Or 100 reps,
right?
Slow, controlled.
Do you know where they have these machines though? Is physical therapy. So he could find a physical therapist. His insurance will pay for it. Go ahead.
Well, I was going to say, if this physical therapist is paying attention,
right,
and is not just doing an eval and then passing them off and saying, "Here's a sheet of exercises."
No.
Ride a bicycle.
My physical therapist never did that. I had to go in and do these exercises. They had 1 million machines where they could isolate all these different muscle groups and stuff. That's what you want to find.
That's what you want, and they are out there. They are out there, wonderful ones. But there are also ones out there that just are numbers, just like any other profession. We'll go in and they'll let you start. They'll say, "Well, go ahead and do those strengthening." No, you need somebody that really understands hypermobile disorders and how to identify these small stabilizing muscles that can help stabilize these joints.
And you can call them and ask them and say, I would like to speak to one of the therapists. This is what I've got.
And sometimes you can find a physical therapist that's got your disease.
Yeah, right.
Which, like, if you got
maybe
scoliosis,
that's why they went into it.
Right. If you've got scoliosis, maybe you got somebody that's got scoliosis, and they can say, "Hey, this is what I do, and it helps."
Yeah,
so, I would ask that. Yeah.
And I want to emphasize that hypermobility spectrum disorder is a spectrum. It is not the same thing as Ehlers-Danlos syndrome, and that's a kind of edge. That's why they renamed it.
Right.
So.
But
anyway,
keep exercising.
And what about going to a DOM?
Yeah, acupuncture for sure for tendinitis, overuse syndromes, it works exceptionally well. I think acupuncture, physical therapy, and certainly osteopathic. An osteopathic approach sometimes to make sure that if you do have bones that are slightly out of place, that we get them back to where they're supposed to be to allow. A shoulder maybe to move more freely because if it's out of place, because you have a lack of tension in these joints, then it just makes everything worse.
Yeah.
So a holistic approach.
There are some benefits to this, by the way.
Oh, are there really?
Yeah, well, there can be.
Okay.
It depends on where you are on the spectrum, but people who are hypermobile but functional may be faster runners. And some people have posited that Michael Phelps might have some hypermobility.
I could see that in his shoulders.
Yeah,
the way his shoulders move. Oh,
yeah,
man. Mm-hmm. He has really flexible shoulders for such a strong dude.
They naturally have a larger cerebellum than average, and the cerebellum is the thing that stores the mental map and processes movement and stuff. And without training, people with hypermobility can sometimes be awkward, but when they do train, they can become super coordinated. So
now, can I add to that too? Now that you mentioned the athletes, that reminds me of a pitcher for the Pirates back in the 80s and 90s. Maybe Kent Colby was a sidearm pitcher, and you can see images of him, and it was like when his elbow was in front of his body, his hand was behind his hip.
Really?
I mean, it was like, how in the world does that even work? But it was kind of a whiplash thing. So maybe he had a touch of that. Yeah.
And someday, if someone's deficits outweigh the benefits, because there are cognitive benefits too. People with hypermobility disorder tend to be have higher IQs. than people who don't, which is kind of interesting. Now, that's an aggregate.
Yeah, sure.
know.
That's wild.
But if your deficit outweighs the benefit, then in the future we may have a genetic fix for this because they're working on editing people's genomes.
Yeah.
There's some real philosophical and moral and ethical issues about changing someone's DNA, but when it comes to something like this, or if you were at risk for Huntington's syndrome, I think most people would want to have their genes edited so they didn't have to worry about it.
Yep.
So
yeah, I would think so.
That's a whole other story, though. All right,
well, hang in there, buddy, and thanks for being a new friend.
Yes, and I need to send texts to everybody that's sent in. I used to do that always, and I've gotten kind of behind, so I haven't been doing
busy,
it, but
though.
I do need to do that.
Yeah, hey, Dr. Steve.
Yes.
Could you talk about this thing called vabbing? I really don't get it, at all.
Okay.
Thanks.
Do you know what vabbing is?
No, never heard of it.
Okay. Of
course, I hadn't heard of a centipede movie.
Oh, yeah, okay, fair. It's vaginal dabbing, and what women do is, well, not all women, but some women, take their finger and shove it in their vagina and then use it as cologne. And they'll put it on their pulse points like necks and wrists like perfume. And they think it's a pheromone-based scent to attract romantic partners. Now,
say that again. They
take vaginal fluid and then they dab it, behind their ears and on their wrists and stuff like perfume.
Gotcha.
Thinking that somehow that's going to attach. And
interesting.
Yeah, there may be a placebo effect to this, that the person who does this feels more confident because they did it. It's like some people who have performance anxiety, men who have performance anxiety when it comes to erectile dysfunction. They don't have anything physiologic wrong with them, but they just get scared and then they can't perform. But they put a Viagra in their wallet and all of a sudden they're fine because they know they've got that secret weapon in their back pocket.
Yeah. Right on.
This was popularized by TikTok in 2022, and there was this influencer that, started this. And dermatologists say, obviously, endocrinologists as well say there's no scientific evidence to support that this does anything. But what if you had herpes or HPV and then someone's nuzzling around on your neck because you got, could there be transmission? I do not know that there's ever been any single case ever reported where this happened, but there you go. But I think it's the placebo effect. But it's
interesting.
Women, please stop doing that. And I saw an Instagram post talking about this and it just said TMI, and they just meant too much internet. It's pretty funny.
It is true. Oh wow,
right.
That's
a
crazy.
good one. All right.
Hey, Dr. Steve.
Yes.
Got a question here. I don't really, I don't know how to say it other than
just say it.
Why is it that you really got to take a
poo
after you drink coffee or that espresso stuff? Hey, thanks.
Yeah. Okay. Well, coffee acts just as a natural stimulant. It's for the most part the caffeine, because when you do decaffeinated coffee, it's not as predominant of an effect. But even decaf can do it. So there's other things in coffee. Like, for example, I can drink tea. It's got caffeine in it. I can drink, 5-Hour Energy. It's got caffeine in it. But I can't drink coffee. So there's something else in there. But coffee itself triggers the release of a hormone called gastrin and another one called cholecystokinin, which cholecystokinin causes the gallbladder to contract.
Right.
And this all speeds up digestion. And, the heat of the liquid, you've talked about that before too, that speeds up
And the time of the morning people usually drink coffee is about the time of the morning we normally go.
It may just be that.
A lot of those things together, yeah.
So now, so it's not universal though. Not everybody has that. Obviously, this caller, who sounds like I'm sure she lives in Alaska somewhere, is obviously affected by it, but not everybody.
Right on.
All right, now let's just say you're lactose intolerant and you don't know it, and you put milk in your coffee. That could do it too.
That'll do it for sure, yeah.
So it may just be that.
Yep.
So anyway, all right. Well, let's get out of here for this week. Don't forget Dr. Scott's website at simplyherbals.net. It's still going, so check that out. We're no longer selling Dabble Dice on the main store at dabblegames.myshopify.com, but somehow people are still ordering it. I don't know how. There's some channel somewhere, some button somewhere where people can order it. And feel free, if you order one, of course I will send it out. And I send you an autographed card that shows you how to play Deuces Wild in the casino. I can't sell those because when I tried to do that, Google shut me down. So, but it'll show you how to play correct strategy on the one game in the casino that has a positive expected value for the player. And then I throw, some other stuff in there. Sometimes it's a holographic Weird Medicine sticker. Just who knows? But anyway, if you can find it, you go right ahead. I've still got 2 boxes of the effing thing, so I'll be giving away these at Hackamania to VIP listeners, and I'm sure people can win them or whatever. So, or just come and see me. I'll give you one. All right. Well, thanks always go to Dr. Scott. Thanks to everyone who's made this show happen over the years. And until next time, check your stupid nuts for lumps. Quit smoking. Get off your asses. Get us some exercise. We'll see you in 1 week for the next edition of Weird Medicine.